Rogers TV.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I am delighted to have as a guest Health Manager, Infectious Diseases and Sexual Health at Grey Bruce Public Health. And she's here to talk to us about a couple of very current things happening in our community. One is pertussis, and she'll explain what that is. And the other is mpox, or referred to as monkeypox. So I'm delighted to have Gillian here because certainly when I was reading the news releases from public health, I mean, these are two current news releases about incidences and things that we need to know about as a public. So Gillian, welcome.
Thank you. Yeah, definitely two hot topics in public health right now that I'm happy to be here to talk about. And perhaps should we start with pertussis?
Yes, I think that would be good. Now, certainly pertussis in the notes, and thank you for the questions.
Yeah.
You know, I'll certainly go through them, but my goodness, you just add whatever you'd like.
Sure.
But you know, it's pertussis is of local and provincial concern, and I'm wondering if you can explain that a bit more.
Yeah, for sure. So locally this year, so far, we've reported around 20 confirmed cases, and that number is very much what triggered that recent media release that the public health unit put out. So I guess to start with, we should probably say pertussis. Most people are probably going to know it as whooping cough. So pertussis is the name of the organism. So I default to pertussis, but yeah, we are referring to whooping cough here. So our 20 cases that we've seen so far in 2024, this is quite a bit of a contrast to where we've sat over the last few years, which has generally been about 2 to 3 cases. So quite a big jump for us. However, our current situation kind of came in 2 waves. So earlier this year, so between January and April, we saw a small cluster in a community that had lower vaccination rates, which wasn't a huge surprise to us. So we kept an eye on that, and it seemed to resolve itself. And then things got pretty quiet for the summer months until we hit late August, which is when things picked up quite a bit for us. So we've seen some cases in a mix of individuals. So folks with no immunizations, a little behind on immunizations. And though we've had some household linkages, so again, clusters where we know where people have got their infection from, we were also seeing a good number of people just pop up in the community where we didn't know a direct link to another case. However, this was coming at about the same time that we were starting to receive notices from other health units that they were seeing an increase in pertussis circulation within their health units, and even that they've identified, say, a case of pertussis that attended an event or a camp or something in our area. So we know what's circulating here and outside, and because it's summer, people are traveling here and there. So I think that likely contributed to kind of that ramp up pertussis late August.
Now, it's a bacteria or a viral infection. What exactly is pertussis?
Yeah, so pertussis is a bacteria, unlike COVID or influenza that we've talked so much about over the past few years, which are viruses. So this is a bacteria that does spread from person to person through coughs and sneezes, very much like COVID and influenza. And it is also highly contagious. So causes those respiratory illnesses that we're so familiar with. But the distinct part of pertussis, for those who really experience the full range of symptoms, is a quite severe cough. So people develop the cough over the course of the illness, and as you kind of get a week or so in, generally, it starts to come in fits that result in people often kind of gasping for air. Sometimes people cough so hard that they vomit. So it is quite persistent. It can last a couple of weeks, so that definitely sets it apart from an illness that maybe we see like our common cold that resolves in a couple days or so.
Now, is there an age group? Like, is there a more common age group, or can it affect all ages? And if it does affect all ages, is it more serious for certain ages?
For sure, yeah. So anyone can get pertussis, but the people that we see who are more likely to get it, or when they do get the more severe version of the infection, are those who are unimmunized or underimmunized. So for this, of course, we think of babies, so people who have been too young to receive any vaccinations, or we also see people who have maybe fallen behind on their vaccine schedule over the course of the pandemic or just in general. But for babies, when we think about the symptoms that we just talked about, so coughing so hard that you're having a hard time breathing or throwing up, that's quite detrimental to them. So in infants, some organizations say that like up to half of babies less than a year old who do get infected with pertussis require hospitalization. So when we think of our public health prevention and in our case and contact management, they're definitely our key area of focus, as well as moms who can pass pertussis along to their babies if they acquire in that late stage of pregnancy. So
Adults who've been vaccinated years ago, I won't say how many for some of us, does that keep them safe forever, or is it like something you need a booster for?
So, unfortunately, the vaccine or even past infection for pertussis, it does wane over time. And that's why we see in childhood the vaccination schedule being quite intense. So you're getting, I think, 4 doses within the first year and a half of life. You get a booster again when you go to elementary school, a booster in high school. So generally, they recommend that adults over the age of 18 are getting a booster at least once. And then further recommendations for people who are pregnant in their pregnancy, I think both to boost up the protection to ensure that they're not infected at the time of birth, but then there is also the possibility to pass on some immunity to the baby, which benefits them in the first 3 or so months of their life until they're able to start on their own vaccination path.
Now, it's called whooping cough because it's quite distinctive, isn't it? Once you hear, what makes the whoop?
It is that end of the coughing fit where a person tries to do that deep breath in after expelling more oxygen. So it does really cause that big gasp at the end of the cough. And it's interesting. We have some local physicians who diagnose cases, and that is definitely a distinct marker of the infection, where they'll call in and say, I don't have the positive test result yet, but I heard this client coughing in the lounge and it was that very distinct sound. And sure enough, that positive result comes back. So yeah, that is definitely what sets it apart, as well as the lingering of that coughing with that whoop.
Wearing masks, is that helpful when little ones or children are out and about?
Yeah, so we saw during the pandemic that overall rates of whooping cough, pertussis in the province did come down. So I think there can be maybe a couple different thoughts as to why that happened. So was it because less people were out and about, less people were maybe seeking healthcare? So maybe they were getting it, not getting it diagnosed. We do know it is an underdiagnosed infection, as for some people that are immunized, the infection can be much less severe, and it's just a pesky cough that you're dealing with for weeks and weeks on end. But we saw the rates come down, and I think just like many other respiratory illnesses, lots of the things that we were doing during that time, so staying home when sick, wearing a mask in those days immediately after our illness, washing our hands, surfaces, coughing into our sleep, things like that, probably scientifically make sense to help reduce the risk of spreading to other people, as well as probably a bit of a personal preventive measure as well.
What can be done if an individual actually is diagnosed with it? What can be done?
Yeah, so we do, because it is a bacteria, it is has some impact, or antibiotics will help to a certain extent. And the interesting thing about antibiotics in treatment of pertussis is that it both can help lessen the symptoms, but it lessens the amount of time that person's actually infectious. So if we identify a case of pertussis, we'll generally say, unless you get treated, you're staying home for, I think, 21 days after the start of your cough, which is a pretty long time for most people. But if you start on the antibiotics, it reduces the amount of kind of infectious material in your coughs and sneezes. So once you're on antibiotics, we say 5 days after you start, you're able to kind of return to normal activities if you're feeling well enough, of course.
Thank you. Now let's move on to the next one because monkeypox. Oh, I don't know if that's the scientific name, but honestly, this is new to my understanding. I've heard of it briefly, but there seems to be more. Tell us about monkeypox and what is it?
Yeah, for sure. So Mpox is the term we're going by now, formerly known as monkeypox, which when we hear that, it kind of makes me think of what we say like X, formerly known as Twitter. It's one of those type of things. But Mpox is, we start to see it in Ontario. I think in 2022 is when it really made its emergence after circulating in parts of Africa for some time. But 2022, it became a reportable illness. So public health receives cases and follows up with them to do the case management type thing. And in Grey Bruce in 2022, we had 2 cases at that time. We haven't had any since, but it's continued to persist in Ontario, primarily in some of our bigger city centers, Ottawa and Toronto. But what's kind of brought it to the forefront recently has been a global declaration of Mpox as a emergency of public health international concern. And this is due to ongoing outbreaks in Africa, but also the emergence of a new strain that can cause some slightly more severe illness. So similar to how we saw different strains in COVID, we're seeing that with Mpox. So we have one that's circulating here now, and then a newer one that's been identified in Africa that I think internationally has brought a bit more attention.
So it's a virus, so it's different than what we were talking about earlier. It's a virus.
Yes.
Are there certain population groups that are more vulnerable to this?
Yeah, for sure. In Ontario and well, the rest of the world, really, the transmission of Mpox from person to person has been pretty activity specific. So unlike COVID or even pertussis, where we're worried about it kind of being in the air and breathing it in after maybe a person has been in a room, Mpox spreads from person to person primarily with very close, prolonged skin to skin or face to face contact. So the primary activity that we're seeing it transmitted through is sexual contact. So we do know that folks who are at greater risk are those who maybe are engaging in sex work, having anonymous partners, things like that. And when you review reports from the province as to kind of who has made up our picture of cases so far, it has been kind of quite limited to that subset of folks. So that is kind of reassuring to think that locally our risk is low and it's pretty defined in how it moves from one person to another.
Right. So let's talk about prevention.
Yes.
And then what happens if you get it. And I know our producer has images of some of the lesions or appearance. So describe what happens if a person gets it.
Yeah, so Mpox is characterized by a rash. So yeah, the lesions that you'll see in these pictures are what will pop up, but often the illness will be accompanied at first by some really generic symptoms, your fever, sore throat, kind of fatigue. And then if it's a textbook case, it'll often develop into lesion or rashes that start on your face, can move to the palms of the hands, or they may impact areas that have been in that direct skin-to-skin contact with another person who's a case. So for sexual contact, we could see genital lesions. The rash starts kind of flat and then puffs up, kind of blisters over and scabs off. And it's interesting, when we talked about pertussis, we kind of compared it to COVID and influenza, but the tricky thing about rash-causing illnesses is there have been other ones of interest recently, which can sometimes make this a bit tricky. Earlier this year, there was a major focus on measles, of course, and we still see circulation of things like chickenpox and then some non-reportable illnesses like hand, foot, and mouth. So we do generally advise if someone's catching themselves with a new unusual rash, especially if there's a fever that goes along with it, best to speak with a healthcare provider because it's hard to say just from looking at it what exactly it is.
So there are tests that can be run to be able to measure that it is that virus.
Yes.
And how would you know would you know even before you started to get the skin lesions? Or is there anything? And then what do you do to treat it?
Yeah, so no, hard to know for sure. Of course, if someone has been in contact with someone else with Mpox, part of public health's role is notifying of those potential exposures and saying, monitor for signs and symptoms. So if you've had known exposure with someone with it and start to get feverish, even before that rash presents, there's definitely that risk there. So we advise that follow-up testing, which is as simple as a quick swab of the lesions when they're present. So pretty non-invasive. The clade or the strain that we currently have in Canada, so not this new one of focus circulating over in Africa, has been quite mild. So I think in kind of the course of this illness in Ontario since it emerged in 2022, there have been a couple hospitalizations provincially and no deaths. So it's self-limiting. And because it's a virus, antibiotics aren't going to help in this case. So for most folks, it is just kind of comfort measures. So fever reducing medications, maybe bandaging the lesions if they're there. So yeah, most people make a full recovery on their own.
Were they isolated at home for a period of time?
Yeah, so a case, when they have active fever and sore throat and things like that, are advised to stay home, just because though it is skin to skin, there is a slight chance that it can pass from person to person through respiratory measures. But our real focus are those lesions on the skin and the infectious fluid that goes along with that. So once a person's feeling well enough to go out, if they're able to cover those lesions, then they're able to go about their day.
Yeah. So as long as that is attended to,
yeah,
then definitely. So as you're speaking about this, I'm thinking, okay, is that something across all ages and stages people should consider as part of a vaccination profile then?
So interestingly, we do have a vaccine for Mpox. However, the Ministry of Health is setting the eligibility criteria for who can get Immune is what it's called right now. And their focus is a very targeted vaccination campaign. So again, when looking at the folks who have been impacted, it has been a pretty select group. So they're focusing on getting that group vaccinated. So the eligibility list is listed on our website. It is a 2-series vaccine that we can connect folks with, but it is focused on, people who are engaging in sex work or people who identify as being gay or bisexual, men who have sex with men, visiting bathhouses, engaging in anonymous sex, having multiple partners or partners with multiple partners. So we're definitely happy to hear from folks that think that they might be part of those groups and see if they're eligible and get them connected with vaccine if they are.
And if they're eligible, there's no cost to the vaccine?
No, this is a free publicly funded vaccine for those groups.
So sometimes in previous interviews with public health, there's often a seasonal trend towards certain infectious diseases or viruses. With Mpox, it sounds like that's not a feature. With pertussis, is that a feature as well? You mentioned earlier in the sort of early spring and then just recently. Is this a different timing than you would expect?
Interesting about pertussis, it can kind of ebb and flow throughout the year, but then also from year to year. So in the provincial level reporting that's been going on right now about pertussis across Ontario, they really highlighted that pertussis is endemic. So it's with us all the time. We're always seeing a few cases, but every 2, 3, 4 years, we see a little spike and then it'll come back down again. And in looking at our past reporting of pertussis over the last decade, we've seen exactly that. I think 20 is a big number for us, but I think you could argue maybe our population has also grown since 2002 or when we've seen past bigger years. But it's as far as when it's presented within this season of the year, I think we've seen a bit of a mix across the years that I've been with the program.
And it's interesting, the information you shared. The mpox is a provincial and international concern. So
Mhm.
this is one of those situations where globally it is of concern for sure. So, as I'm listening to you, and we've been referencing COVID and new strains of things, honestly, what advice can you give our viewing audience about how do you know what you need to be vaccinated for as we're moving into this fall and winter season, because things keep changing?
Yeah, for sure. I think um, first of all, like vaccines are super safe and effective. And I know that can be a barrier for some as concerns around that. So if that is something when we're talking about what vaccines I need and when, talking with a trusted healthcare provider about information on vaccine safety, I think they can really help fill in any gaps or dispel any myths that maybe folks are coming across on the internet about which ones I should and shouldn't be getting, because those that are publicly funded that we have schedules for are safe and proven. So I'd encourage people to get all of them that they're eligible for. But given that it is such a big list and can be complicated, as we see in pertussis with multiple doses over multiple years and boosters and things like that, our vaccine preventable team here, disease team here, is excellent, can help people review their records and see what they need, maybe any that are coming up in the next little bit, and either direct them back to their healthcare provider to be able to get those ones that they're due for, or for people without healthcare providers, which we know is a local situation, we're able to administer those vaccinations here as well through our vaccine clinic.
So times also have changed where people can go to get vaccines. We now have pharmacies and pharmacists.
Yes.
So my question to you is, how does all this information, let's say I go to a pharmacist for one vaccine,
Mm-hmm.
and my doctor for another, a nurse practitioner for another, health unit for another, how does that information all come to? Is there a central record where anyone can help me know what I'm missing?
Yes. And so this has just been something that has been developing over the last year. I'm sure many of us remember carrying around those little yellow paper booklets in our wallets. So as as time has evolved, most often when you receive a vaccination through the health unit, we have that information already and we're throwing it in a portal. So we have that record of information. Sure, most of us, when we received our COVID vaccines, do remember entering some information. So that's also being compiled within the same database. We also ask, so when your, say, family physician administers vaccine, having that information reported back to us, either through them directly, or if it's information you as an individual or a parent has for your child, providing that for the health unit, so we can get that record up to date. And that process and information and record is available on our website. So you can both pop in there and look at what's listed for you. Obviously, it'll be a bit time limited based on when this database rolled out. And then also might be a good kind of trigger to say, oh, I remember getting my pertussis vaccine last year and I don't see it listed. Maybe I should go ahead and make sure that record is added. For some things, it's good to know personally, but talking about public health case and contact management for certain investigations like measles, for example, how long you have to, if and how long you have to stay home will be determined on how many doses you have. So having that record up to date is a good thing.
That's an important point. I hadn't thought of that, but we think of public health as having information or can talk about protection of vaccines, but also knowing how protected you are, because if you're mid sort of schedule, vaccine schedule, you may not be as protected as you think you are.
Yes.
So that's certainly a really, really good point that I hadn't even thought about. What I think I'm hearing you say then is it really is a partnership. It's a partnership between the individual looking at their record or asking the questions so that they can be current. So that's part. health unit for providing up-to-date information, and healthcare providers and pharmacies for helping to administer. Any other groups I've missed out of that partnership?
No, and I think just to expand on this kind of partnership idea, like vaccination, excellent for self-protection, but bringing it back to pertussis too. So we know pertussis vaccination, good, effective, helps to protect yourself, but that important other element to it is fully vaccinated people protect other people, like babies who are most at risk. So by doing all those pieces that you just described, you're helping yourself and us at public health, but then you're helping your community too, which I think is really important. So
I've heard the term for that, and it always makes me smile. It's called herd immunity. Like we're all together in the field protecting each other. So I think it's an amazing term. We have just a couple more minutes left in the program. What haven't we covered that you'd really like to share with our audience?
Good question. I think kind of on this thread of keeping up to date on immunizations, a hot topic right now, of course, headed into the fall is COVID vaccine, flu vaccine. When can I get it? Where will it be? And so we're still waiting on those final pieces of information here in public health. But we do know COVID is circulating. We've heard that influenza has started to pop up in neighboring jurisdictions. So I'd say keep an eye on public health media releases because once we get that information, we'll start putting out to the public. And as far as opportunities to get those, that's where this greater availability through our local pharmacies has been a good improvement that I think we've seen come out of COVID. So definitely important for protection, as we move into these winter months. It's hard to know exactly what the season will look like this year. We've had abnormal influenza and COVID seasons as we've moved out of the pandemic. So fingers crossed for a mild one, but what will help each person, ensure that it is perhaps mild for them is, taking that initiative to get those vaccines when they're out there and available.
Because the strains of the virus change. And, we hear people say, I'm just tired of having to go and get the vaccine. Your comment is go and get the vaccine.
Go and get it. Yeah. If you're eligible, go get it for sure.
Yeah. I want to thank you for providing current updated information on two important diseases that are out and about in our community: pertussis, or whooping cough, as it's commonly called, and mpox, which used to be referenced monkeypox. Thank you, and please, anytime. We're here to share the information, and I am so grateful to the health unit. No, public health. I know you've changed. Public health for being willing to keep our public protected and up to date. Thank you, Gillian, very much.
Great. Thanks for having me.
Thank you as well to our viewing audience for joining us here on HealthLink. Please join us again to learn more about programs, resources, and services available to you and to your family. Take care. Do thumbs up. Brilliant.
Connect with us by visiting our website or email us at comments@rogerstv.com. You're watching an interesting local show on Rogers TV and you want to know more. That's when you head to rogerstv.com. Our website provides more information about our programs, our hosts, our schedule, and about how you too can get involved with Rogers TV. Visit us online at rogerstv.com.
We've had such trying days the last few months. Henry's health has taken a turn. Our savings are dwindling. But your prayers, they've been our lifeline.